Imagine being frivolously sued by a for-profit company for $1 million merely because you accurately stood up against their misleading marketing and flawed science that was putting people at risk of unintended pregnancy. My name is Chelsea Polis. This happened to me, and it nearly shattered me. My leadership project is one step towards ensuring that it doesn't happen to others. Daisy is a fertility tracking thermometer sold in about 35 countries for about $330. It attempts to predict which days the user is most likely to conceive. FDA forbids Daisy from being marketed for contraceptive purposes since it hasn't undergone clinical studies or regulatory approval. But in years past, the manufacturer claimed Daisy was over 99% effective for contraception, a misleading claim which can put people at risk of unintended pregnancy. These claims were based on a deeply flawed analysis, which sadly slipped through peer review cracks and got published in a scientific journal. I strongly believe that people deserve accurate information upon which to base their contraceptive choices. In 2017, I privately contacted the company to raise my concerns, but they took no meaningful action. So, in 2018, I published a commentary detailing the methodological flaws in the company's paper. The scientific journal agreed with my concerns and retracted the company's paper. I also submitted an allegation of regulatory misconduct to the FDA, prompting an investigation, after which FDA forced the company to correct its misleading marketing claims. My actions, all done on unpaid personal time, helped protect consumers from unintended pregnancy. In media interviews, I used words like junk science to describe the company's retracted study. The company claimed such language was defamatory and sued me for $1 million in federal court. SLAP suits, short for strategic litigation against public participation, are usually not filed with the intention of winning, but of financially and emotionally draining defendants until they give up and shut up. I was incredibly lucky. I received pro bono representation by Dory Hansworth of Arnold and Porter. After 2 long, stressful years, the company lost and have never been able to shut me up. In fact, quite the opposite. Still, the process was excruciating, impacting my health, my family, my work, and so much more. Sadly, my case is not unique. Being vocal about my experience led to meeting others who have faced legal or other challenges for defending scientific integrity. Weaknesses in publishing systems enable some fatally flawed studies to pollute the scientific literature, ultimately impacting court cases, policies, programs, public health, and people. I've also seen this happen in another topic that I study, abortion. Misinformation and disinformation, including in sexual and reproductive health, threatens to unleash very serious impacts on people's health and rights. Protecting scientific integrity is deeply important work, yet it's generally unfunded, it's often demoralizing, and it's sometimes risky. Those risks can also cause chilling effects, inhibiting qualified people from speaking up for evidence, unless we can find better ways to support and protect them. I worry so deeply about what it might be like for somebody to experience what I did, but without the privileges and supports that I was lucky enough to have. In light of all this, I decided for my leadership project to implement a survey to try to understand the experiences, perspectives, and needs of those who work to defend scientific integrity, to compile information on various supports that can be useful to research integrity practitioners, and to disseminate my findings, starting with a peer-reviewed publication, to help raise awareness and champion solutions. I first identified potential survey participants, which is challenging since many research integrity practitioners work anonymously given the risks. I obtained IRB exemption, developed and refined survey questions, and in fall of 2024, implemented the survey. Data analysis is ongoing, but I've identified interested journals and I'm preparing a manuscript for submission. I can't wait until my findings are ready to share. Refusing to be silenced takes courage, and it brought me into community with others who have faced legal abuse, which led me there to advocate for anti-SLAPP laws in hopes of protecting others. Participating in WomenLift echoed this theme. In the incredibly sacred space that WomenLift staff have created, my powerful cohort sisters spoke their truths with a fearless willingness to be vulnerable, ultimately shifting from isolation towards collective recognition, support, and creative problem solving. This theme was also reflected in my personal growth as a leader this year. This journey helped me face how perfectionism holds me back, working to shed tendencies which are rooted in fear, such as by sharing my project idea publicly well before my very annoying perfectionist inner voice felt ready, has opened up new worlds. For example, I've been contacted by researchers seeking my help battling flawed and dangerous research based in low and middle income countries. I've been sought out for board membership on an initiative addressing research fraud, and I've been asked to summarize my findings from this leadership project in a report on research integrity. So for me, this program linked authentic leadership to finding community, to finding a fuller expression of my power, which I can then leverage to help support others. This has been a deeply cathartic year. I'd like to express my sincerest gratitude to everybody who made my WomenLift journey possible, including those who walked beside me on this journey, both in my cohort, but also those across time and geography. Thank you very much.